Hello, everybody. Arizona Attorney General Kris here.
And hi, I'm Dana Nessel, Michigan Attorney General.
And we are so excited to welcome you back to another awesome episode of Pantsuits and Lawsuits, your favorite place to catch up on all the machinations of litigation and in the federal government and in state government and the tangled web that American jurisprudence is today. So, welcome back.
Yeah, this week we are going to be tackling a pretty serious and disturbing subject area. We're going to be talking to Will Humble, who's the executive director for the Arizona Public Health Association, and discussing the Trump administration's reckless, chaotic, and dangerous dismantlement of the nation's medical research and public health infrastructure.
Yeah, and it's going to be awesome to have Will Humble. I think everybody's going to enjoy him, and we've been so fortunate to have him out here in Arizona for a long time working on public health, but man, has this issue ever come to the fore. It's never been so timely, Dana. We've seen obviously mass firings, lab closures, et cetera, at the CDC, at the FDA, and other agencies within HHS. But just in the last 48 hours, we saw, I think, the 3 or 4 top scientists and top people at the CDC walk out in protest against the anti-science agenda of RFK Jr. So a very alarming situation going on, and you have to wonder, and I think we'll probably learn more from them in the days to come, what exactly is going on inside the CDC.
Yeah, it's hard to say in terms of why all of this is happening, I guess I would say. I mean, clearly, I don't think any of us are surprised that RFK Jr. is behaving the way he is. I mean, he's been notorious for decades as somebody who's anti-vaccine and who does not subscribe to the decades and decades of research on the science of many different types of treatments of all the way from just regular ailments to more nuanced types of diseases and infections, and the list goes on and on. But I want to ask you this, Kris, if you have any theories. I know we try not to fall down the rabbit hole too much in terms of these conspiracies, but I mean, climate change, I got it, right? Like I understood exactly what these members of the government were doing, working in coordination with big oil, fossil fuel companies for denial of climate change because it benefited them financially to do so, and it kept them selling their product. So I understood that, right? And there are other things that we can point to where we can say we understand this misinformation or disinformation campaign. Voting is similar to that, right? There was a reason for it. We understood it. But what is this about, do you think? I understand things have changed substantially since COVID, and for some reason, it seemed to benefit Donald Trump to say that COVID wasn't that serious, it wasn't that big a deal, to downplay the number of people who became ill or died from it. But I mean, all of this, what do you think is going on?
Well, I know, and the COVID thing is fascinating to me as well. And from this standpoint, when you really think about it, one of Donald Trump's most important and signature achievements was Operation Warp Speed and the development of the vaccine that's probably saved hundreds of thousands, if not millions of lives, which now, of course, he doesn't take credit for at all, never talks about it, right? The one thing that you could point to in Trump 1.0, and you were there during that time, that they achieved that he doesn't even want to talk about now, and then he hires the RFK Jr. To head the nation's most important health agency, who is an anti-vaxxer, who and I have a theory, and I'll get to sort of answering your question directly, but I have a theory about what one of the reasons that these top scientists just walked out of the CDC, which is I think they're about the CDC is about to put out a report that tries to tie vaccines to autism,
Mm.
and and that they are putting out guidance that will lead to fewer COVID vaccines being available, because if the CDC doesn't recommend it, then insurance companies don't pay for it. So I think that's why a lot of these guys just walked out of the CDC, because they didn't want to be and couldn't be a part of all of that. But to answer your question, I think this is just the quote unquote make America healthy again, which really is a make America unhealthy again movement, is a part of the Trump sort of cult and base. And RFK sort of speaks to that sentiment. And there's just a significant portion of the Republican base right now that is anti-vax, anti-science, and I think that's kind of what's going on here. And it's the problem is that it is so dangerous. We got a
Yeah,
measles outbreak right now in the Southwest.
yeah. From the very early days of Trump regaining office, we began to see all of this, and the NIH cuts, happened almost immediately out of the gate. And I think that that's a place where, in some instances, we were really successful. Also, the public health grants to public health departments that, again, they don't just deal with things like measles or mumps or polio or things of that nature. I just thought we had another Legionnaire outbreak here in Michigan. I mean, that's one of the things that those local health departments test for.
Right.
Also, sexually transmitted diseases. I mean, really the list goes on and on. But what I think we've been so successful in doing, the Democratic AGs anyway, is oftentimes challenging these cuts. And what I found really interesting, I just saw a statistic on this, is there were a number of public health grants that were paused by the Trump administration. The Democratic AGs filed lawsuits, and the Republican AGs did not join us in that effort. And so a number of those grants were unpaused and made their way to Michigan, their way to Arizona, made their way to other states represented by Democratic AGs, but did not do so in states that were represented by Republican AGs. And I just don't understand how in those states people are just fine with all that happening. I would want to make sure that my community was as protected as possible from those things. But you're right. Maybe this anti-science bent, people don't care until it affects them directly, and even then, people seem like they're in a sense of denial.
Yeah, and you make a really great point that, when you look at that, I think that's one of the incredible ironies, and frankly, there's a sadness associated with it, of our litigation, is that the states now that are being hit the hardest by these funding denials and clawbacks and rescissions, et cetera, are the Republican states. Um, I think the problem, and obviously that's incredibly sad for them. It's, that they're being harmed the most because they don't have an AG fighting for them. But the problem, I think it's particularly troublesome when it comes to public health grants, because we are a nation when it comes to public health, right? If there is a measles outbreak in Texas because Texas didn't fight for its own public health grants, and uh, you know, and then that spreads to New Mexico, and that spreads to Arizona, and that spreads to California. We are a nation, um, a nation of states. And in this particular area, I think these cuts and the failure of the Republican states to fight against Donald Trump's cuts is particularly impactful potentially. And to your
Yeah.
point, we won't find out until there's a nationwide outbreak of some sort.
I remember several years ago, you might remember this as well. I think it goes back to the Obama years, actually, when there was an Ebola outbreak in Western Africa. It spread to the United States, but only very minorly so because they were able to contain it pretty quickly. Now, part of it was the programming that we had been doing through US aid out to Africa to help them contain it before it spread worldwide. But even when it came to the United States, it was really limited because of the quick action of the CDC.
Right.
And God knows how many people would have died from this horrific and very infectious disease had it not been for the fine work that some of the best and brightest scientists in the world did working, for the CDC.
Yeah, and I mean, to, to that point, I was watching some coverage of what's happening at the CDC this morning, and one of the reporters said that she had spoken to 15 people inside the CDC, and that because of this, the four top people just walked out, everything going on, very few people, her words were, very few people are working right now. Well, that is, my God. And that is alarming, given how important the CDC is, the FDA, which protects our food supplies, as well. I guess taking it back up to the federal level, I mean, obviously we're doing everything we can to fight these cuts as AGs, but my God, where are people like Senator Bill Cassidy or Senator Tillis? Cassidy's the doctor, right? He's the doctor
Yeah.
senator from I think Louisiana, who was he was the vote that allowed RFK Jr. To be confirmed, essentially. So was Tillis. Tillis said recently in an interview that he voted for RFK Jr. because Cassidy did. And he took his cues from Cassidy. Where are these guys,
It
Dana?
just really shows you the stranglehold, right? That Donald Trump has over everyone. And, it doesn't matter what your degree is in, it doesn't matter how you spent your professional life. All of that is really put to the side, and you have to just go with whatever it is that the president wants at any time. And I think what we've seen in large part is um, President Trump doesn't care about any of this. I don't know frankly, what he really does care about, except for his own personal interest and that of his friends and family members. But I mean, I don't see how we prevent a nationwide outbreak of some very, very serious, airborne disease or even a food borne disease that is not going to be contained the way that it has been in the past, because as you suggested, people are too afraid to do anything, and they're just not working and doing their regular jobs that would prevent these things. And one of the things, I think we've talked about this before, is the reason why we can't just do this on a state by state basis is that, firstly, we don't have the staff for that. We don't have enough people working in our respective
Right.
states who are those experts. But it's so important to have the coordination from state to state to state. And so that we can find out what's going on in Georgia, if there's some sort of, an outbreak there, so that they can tell our states about it so we can be prepared. But if we don't have a national vector for that information, how are we supposed to coordinate? I mean, we are the United States of America, and we're supposed to have a federal government that is in charge of that coordinated effort to combat disease.
Yeah, I mean, exactly. And that just doesn't seem to be resonating in the halls of the White House and in Washington, D.C. right now. I mean, we obviously objected to it, but I think it's important to remember what RFK Jr. has been doing from the get-go. He abruptly fired 10,000 HHS employees. Um, and that was terrible, obviously. And you know, and now on top of that, we have some evidence that something really bad may be happening inside the CDC in terms of whatever they're about to put out that whether it's autism, being linked to, or they're going to try to link autism to vaccines, or the COVID vaccine not being approved. RFK Jr. canceled the mRNA vaccine research. Remember that just happened, just canceled it. mRNA research. This is incredibly important research that has the potential to solve for and resolve all kinds of illnesses, you know.
Well, and this is when you have people who are put in these incredibly important areas of government who have no expertise of any kind and only a political bent, and that's why, you can't have politics supersede science. And again, we laughed a little bit when we saw at first the lack of experience and qualifications for people that were being placed in these incredibly important positions. But we see now what that actually means. And had it been a situation where you had an unqualified person coming in to head the organization, but really it was the longtime civil servants that were running things behind the scenes, I think we would have been okay.
Yeah.
But that's not what's happening at all.
No. No, no, it's not. And I think RF, I mean, a number of Trump's appointees who were confirmed by the Senate have turned out to be problematic, but I think maybe none more so than RFK Jr. in a lot of ways when you look at the things that he is definitely doing on a weekly basis that undermines public health, that at the end of the day is going to make us sicker. Literally, people are going to die as a result of some of these decisions. And I think that is why these top officials ultimately walked out en masse, to try to call attention to what's going on. And I don't know. I just go back to these senators, and maybe I'm being naive here, and I'm asking too much, but I go back to these kind of moderate Republican senators, and I'm like, where are you? You can speak out. You can come back and say, because Cassidy, when he was confirming RFK Jr., asked him point blank. I was watching the hearing on it. Are you going to support science-based research? And are you going to try to make some of these linkages that are insane and not proven? And RFK Jr. just lied. He just lied. And I guess I'll make this last point. This has a real impact on people. I was talking to somebody that I know pretty well the other day. She's got young kids. And, like most people, she gets a lot of her news from social media. And she was saying to me, well, Kris, I'm really hearing a lot about these vaccines. I'm not sure I should get my kids vaccinated. And this is a person who's really smart. And it's just astonishing. And I said, no, and she's like, I don't know who to trust. Should I trust my pediatrician, or should I trust what I'm seeing on social media? And I said, trust your pediatrician. But that's just sort of like an anecdotal evidence of what this does to people, I think.
Yeah, it's really damaging. And I think back to when my kids were young and first getting all of those vaccines, and this was already, 20 years ago. And, there were so few instances that you would hear of people saying, I'm not going to have my child vaccinated and trying to get a waiver or something of that nature. I'm not going to say it never happened, but, it was unlikely. You didn't hear about it very often.
Right,
And just how quickly this disinformation campaign has taken hold of our country.
right,
And I mean, there are a lot of different theories for it. I think some of it starts with foreign actors that want to destabilize the United States in all kinds of ways. But, it's one thing to not have faith in voting machines. It's another thing for people now not to trust things like basic childhood vaccinations. And this is a dangerous and scary time. And I think it's not going to be long from now. We're looking back at this recording we're doing right now and talking about the deaths of an untold number of people. And the thing is that, what happens in the United States is not going to stay in the United States.
no.
And I almost wonder, like, at what point will other nations say, you Americans can't come here because we can't trust that you're not carrying various different kinds of deadly diseases? I mean, as you know, I mean, I'm looking right now into Canada. I'm in Detroit,
Out
in
of
my
your
Detroit
window?
office. Yeah, and
Uh-huh.
I'm looking at Windsor, Canada, right out my
Wow.
window.
Wow.
And it is such an easy thing normally for us to just drive across the border. When I, used to be at the Wayne County Prosecutor's Office, which is a little bit closer. I'm in Midtown Detroit. That was closer to downtown Detroit. We used to go to Windsor for lunch on a daily basis. But now, I mean, it makes you wonder if there are, going to be the same way that it's more complicated for people to come to the United States from many countries and have to get specialized visas and all the rest. Will that be the case in terms of Americans trying to travel? Because normally it's very easy for Americans to travel around the world, much more so than just about any other nationality. But I can see that that's probably going to change in large part because of our healthcare here and the concerns that people are going to have when people are not vaccinated against just diseases that we thought we eliminated many decades
Ye-
ago.
Yeah, decades ago, which was a huge accomplishment. I was just going back to your original question, why do we think this is happening? I mean, I will say that I think there is a part of the Maha movement that resonates across the political spectrum, and that is people feel as though our kids are less healthy than they used to be, are eating more poorly and are getting too much junk food. As a mom of a 12-year-old, I can say that's something I worry about too. And I struggle with in terms of trying to make sure that my kiddo is not eating too much junk food, either at school or at home. But unfortunately, and so that is a good sentiment, right? Like that's something we all agree with. But unfortunately, that then bleeds over into this vaccine realm, and that is a whole different story.
Yeah.
And
I mean, I think it's one thing to say that you don't want your child to eat too many Twinkies, or Cheetos. It's another thing to say, and so I'm also not going to get my child vaccinated against rubella,
right,
right? I
get the
mean,
MMR vaccine
yeah.
on schedule, or at all, or at
Yeah.
all. So it's going to be interesting to see how all this plays out. I hope it's the ending of all of this is not tragic, but we do have a great guest coming up. I'm super excited for you to meet him, and I think that Will Humble will hopefully be able to answer all of our questions about all of this, and maybe a little bit more. And he was on the front lines of dealing with the COVID crisis here in Arizona that I know you were also on the front lines of when you were AG.
Yeah, and something that I find to be startling, but I had these meetings with members of local health departments around the state, and so many of them, I mean, at one time they were welcomed as heroes in their communities, and now so many of them are afraid. People are afraid to go into these professions, just working at your local health department because of the threats they receive. And it's just the insanity of the fact that you can't work in public health without being the recipient of death threats. It's terrifying.
That is literally crazy and reminiscent of elections officials out here who also have been receiving death threats or certainly did in 2020 and 2022. And it's terrible. And that I think there are all kinds of sort of, I don't know, implications of all of this that going on right now in Trump 2.0 that it may take, a decade or so to fully comprehend and understand, including the brain drain. I mean, when you look at all of the people who are leaving these critical agencies, whether it's the CDC, all of HHS, DOJ. I mean, think about this sort of our realm, DOJ.
One of the issues that we have here, with not just the fact that, of course, that so many people are going to be cut off from Medicaid. And in Michigan, it's estimated could be, 700,000, 750,000 people who are going to lose their health insurance because of the new budget deal. I forget what's the phrase you use for it because I won't call it by whatever the official name is.
Well, I call it the big bullshit bill, but I
Okay,
don't.
I
Are we
like it.
allowed to say that on this podcast?
I think
But
we are. We can say
okay,
whatever we want.
okay, yep.
But it's also the fact that so many of our doctors in the state of Michigan, in not just in like the southeastern area where Detroit is located, but even in the very rural communities, there were programs to bring in foreign doctors. And so that we had healthcare officials, and now those people, like, they're not coming in, and so we are going to have an incredible shortage of medical professionals, not just in the state of Michigan, but all across the country as a result of this combination. It's not just the anti-science bent, but anti-immigration as well. Those will, coincide together with a lack of healthcare treatment, along with all the other issues that we've talked about before with the new budget deal.
Yeah, you make a really great point, which is that that all of this sort of feeds on itself, and there's so many we're taking so many hits in so many different ways against public health, whether it's from the Medicaid cuts, which will decimate all rural hospitals, rural healthcare, or what's going on at the CDC and what's happening with public health policy. It is so good to see you, Will Humble. Thank you for joining Dana and I. I want to introduce you to our listeners. You are the executive director for the Arizona Public Health Association, but you've worn many hats in your past, including heading up Arizona's top public health agency and a few other things. So welcome to Pantsuits and Lawsuits, and we'll just jump right into it. We are so glad to have you, given everything that's going on in the last 48 hours at the CDC, where we had, I think 3 or 4 of their top officials walk out in protest, and also, NIH cuts, which Dana and I and the other Democratic AGs have been fighting against. Let me just ask you about the latest news. What do you make of what is going on at the CDC?
Well, I've got some colleagues that I know inside CDC, and so I try to get some like inside the building scoop on what's going on. And when Susan Monrose was first nominated, there was like the employees over at CDC were like, we really don't know her that well. She's has great academic credentials. She's really well respected professionally. But what we wonder is whether she will stand up to Mr. Kennedy, Secretary Kennedy. And they didn't know whether, because you can have different kinds of directors. Some will be super compliant and really just try to keep their job, and others will be in it so that they actually do their job. And they discovered very quickly that she was exactly who they wanted. Somebody who would stick with the evidence, stick with science, make evidence-based recommendations and decisions for what the agency does. So they were really pleased to see her in action, respecting the staff and lifting up the expertise within CDC so that the secretary would hear from them if he was interested. It appears he is not. And then with the shooting a couple weeks ago, she had a very compassionate response. She had an all-staff meeting. She was very emotionally intelligent about how employees felt. She was receptive to allowing employees go back to remote work temporarily as they felt unsafe, in their work environment. And so the staff is really now just like, oh my gosh, now what? And I haven't talked to anybody since this new O'Neill person was put in as acting, but I looked at his academic credentials. He's from the humanities. He's a Peter
He doesn't
Thiel.
even have a medical background, right, Will?
None. No, just his job is listed as an investor. Didn't know that was a job, but it means he's rich, I guess. But his academic credentials are in the humanities. I don't think he's going to end up being the permanent. I think he's interim. he's going to go back to his old job at HHS. He's Senate confirmed in a different job at HHS. So remains to be seen who they can get for that job. These are really important decisions, but it's clear to me that Secretary Kennedy's interested in, in a lapdog, basically somebody who will do whatever they are told. And I'll stop talking in a second, but when he releases his report next week that we all expect he will say vaccines are causing autism, he will then start directing the CDC director to eliminate some of these childhood vaccines, which will be catastrophic. Now, he hasn't done that yet. I'm just forecasting, but I'm also using stuff that he said at the cabinet meeting last week that supports what I just said.
So
Can you talk, Will, a little bit about what your projections are? I mean, if this happens the way that you believe and many others seem to believe this is going to occur, can you tell us how quickly we're likely to see an impact, and what kind of impact do you anticipate? And if you could also talk about the importance that the CDC plays nationally and internationally in containing these types of diseases.
Yeah, so to the first part of your question, I think what remains to be seen is whether Article 1 of the Constitution still means anything, because up until now, we haven't seen any real oversight from Congress of the decisions being made within the executive branch. The only thing that's been holding the public health system together in the last 6 months is Article 3, your work as Attorney Generals pushing back on both illegal and unconstitutional decisions that this administration is making. So what's going to happen hinges on whether Congress wakes up, whether those committees in the Senate, especially in the Senate, I think there's 4 Republican physicians in the Senate, if I'm right.
Right.
Whether they, say, okay, this is a bridge too far, Secretary Kennedy, we are not going to tolerate these kinds of decisions. And so whether they stand up or not is ultimately the answer to your first part of your question. Do we start to see checks and balances from Congress, or are we gonna, for the next at least year and a half, have to rely on the judicial branch and plaintiffs like yourselves to keep the wheels on? And I can't give you an answer to the question because I don't know whether they're going to stand up to them or not.
I mean, Will, I was just talking with Dana on the introductory part of this segment about what you just said, which is that Bill Cassidy is a doctor who started a rural health clinic or a health clinic in Louisiana. He's and he is the guy whose vote led to RFK Jr. being confirmed in the Senate. I didn't realize there were 3 other doctors in the Senate, but great point. They're all Republicans, I guess. Like I just can't. I mean, I can't fathom the fact that they would say nothing. But we're dealing with the cult of Trump, and they're terrified. But I don't even think Cassidy is running for re-election. I'm not sure. But I don't know. That's just a little rant on my part, and I think it's an important point that you're making.
And it goes to really, is their professional? Is their profession as physician, is that more important or less important than the political ramifications of taking off the president?
Right. And then I think you make an incredible observation, and I had kind of heard the same thing, that they may be on the precipice of releasing this study that tries to tie autism to vaccines. I hadn't really understood that would then lead possibly automatically to them saying, don't get the childhood vaccinations.
Right. Well, it wouldn't directly, but because Secretary Kennedy got rid of everybody on the advisory committee for immunization practices and replaced them with mostly anti-vax people. There's a couple with like real credentials that are on the new ACIP, but that's the next step. So what I expect to happen is this report comes out. He's going to say autism is caused by vaccines. He's going to call an ACIP meeting with his new members who will then make recommendations that would become part of the Vaccines for Children program, VFC, which provides vaccinations for more than 50% of the US kids, and private health insurance, who would then adopt the new ACIP standards. And then you would have, I don't know which vaccines, but some vaccines being dropped off the list. Now, it hasn't happened yet, but I'm just looking at the road that he's grading, and that's where it's leading, in my opinion.
So, Will, let me ask you this. What I've been hearing and reading about is that, many, I don't know if it's the AMA, but, there are sort of alternative boards that are not official boards that are being formulated because obviously so many physicians and infectious disease experts and all the rest know that they can't have faith in the government experts anymore. Can you tell us what you know about that?
Yeah, I mean, I'm really proud of the American Academy of Pediatrics. Their board and their members fully recognize that they are going to really need to step up over the next 3.5 years to provide real life evidence-based recommendations to especially pediatricians. And so that's what they've been doing. So they've said they've committed to maintaining their own recommended childhood vaccine schedule. The problem is that US law and the regulations that have been established as Code of Federal Regulations all refer back to the Advisory Committee for Immunization Practices and the CDC recommendations. So, as a matter of practice, in terms of reimbursement for vaccines, both the administration and the vaccines themselves, everything hinges on, can we get paid for these things? Because that's how the system works. And even though the American Academy of Pediatrics may continue to recommend the full schedule, if ACIP and CDC cave in on some of these things and reduce the schedule, then the Vaccines for Children program would automatically drop those vaccines, and 50% of kids would automatically not have access to those life-saving important vaccines. And the private health kids with private health insurance, their plans would likely stop covering it. And so even with the private and even with those member organizations, is what they are, having alternative schedules, as a matter of law, in terms of reimbursement from CMS, Center for Medicare and Medicaid Services, and Vaccines for Children program, which is run out of CDC, they would become inaccessible. So again, will Congress step up and say enough is enough? And you all will most certainly play a role, the Democratic attorney generals, in saying, can we find an argument in court that this doesn't meet the statutory standard for reducing these recommendations or not? And hopefully some of those cases may give at least injunctions or to stop some of those decisions.
That's so
sorry to interrupt.
No, I was to just to drill down a little bit further on that. What would, so if we had to private pay for a vaccine for the MMR vaccines, what would that cost? Do you have any idea?
I don't know about MMR. For the COVID vaccine, for example, is about $200. $200. I don't know about the MMR. I didn't research that. But I could tell you, a Medicaid member who walks into their pediatric office and is told, we really recommend this MMR vaccine to your kiddo, but you're going to have to pay cash for it. Some will not eat that week so that they can pay for the vaccine, but others will take a pass. And it will, Kennedy's been will continue to talk vaccines down over the next 3.5 years if he's in there that long. But this is an administrative mechanism to change the funding to make that a reality. So it's not just what he says into a microphone, but decisions that he and his agency directors make that make the vaccines inaccessible.
So, well, Dana had asked a question earlier that I thought was really interesting, and I wanted to get your take on it. Which is that, okay, we've got RFK Jr. was a terrible idea. I think all three of us agree on that. But RFK Jr. is channeling something out there that the MAHA movement. What do you think is driving that? And where is all of this vaccine skepticism and hesitancy coming from, because it's, RFK Jr. is a conduit for it, but there's something else out there, and it's all part of Trump world as well.
Yeah, no, so I don't have any, I'm just going to speculate because I have no evidence to support anything I'm about to say. But I think it really goes down to the years long effort to erode trust in institutions that has been pushed by Fox News and Newsmax and some of these so-called mainstream media outlets that are over time have really eroded trust in institutions and experts. And I think what happened during the COVID pandemic and the guests that they platform on those stations reinforced and really supercharged this distrust of experts and institutions that used to exist. And so now there's a distrust of institutions and expertise, and people are putting their trust in influencers, whose business model depends on clicks, that reinforces this lack of trust in institutions. And like, how do you get that back? I don't know. But that's what I think it is. It's an erosion of lack of trust and they're placing trust in people without any kind of credentials, without any evidence to support the things that they say. And the media outlets that the folks are getting this information from are not the journalists and commentators aren't challenging any of that, and they continue to platform this kind of stuff.
Yeah, one of the things I found really interesting was that the new budget bill, I will call it, sets a lifetime loan limit of $200,000 for medical and dental school, even though the average cost of tuition through graduation normally exceeds $300,000. So you're basically saying that unless you're, a multimillionaire, people can't become doctors anymore. Which is, I mean, to me, and I will say this to you as a Jewish person, doctors are the most esteemed individuals. Like my mom to this day is like, why are you an attorney general instead of, an internist? Because she would have preferred that, because that would be more bragging rights for her in her friend group. But for real, I mean, growing up, like, one of the things that was always interesting to me is, when I was trying cases, we would refer to anybody else as Mr. or Ms., but not medical doctors. They were Dr. So-and-so, Dr. whomever, because we revere doctors. And so it's so bizarre to me that this administration is really handicapping our institutions and making it almost impossible for people to become physicians in the first place.
Right. And it's a double, and they're doing it in two different ways. Number one is what you already mentioned in terms of, the medical school part of this. And by the way, what that does is it puts even more pressure for new physicians to specialize in procedural high-end practice. And and that's great. Surgeons, we do need surgeons, but where the lives are really saved is in primary care. I mean, they're the ones who identify the blood pressure 20 years ago that would have ended up in a stroke or a heart attack 20 years later, and a surgeon going in and trying to fix that stuff. So the way you keep a population healthy is with primary care visits. And it already is, because of the cost of tuition and the lack of federal support for those primary care specialties, there's already a disincentive to doing primary care. And this just makes that even worse by not supporting there. And the other prong of this that needs, I think, a lot more attention and people recognizing this is that residencies are as important or more important than the number of, I would say more important than the number of medical students. And we've got to start investing more federal funds and distributing those funds more fairly among the states for graduate medical education. because that is what builds the pipeline for physicians. You could graduate from medical school, but if you don't find a residency program, you're not going to be practicing in the field. So residencies are, I think, the most underappreciated part of building the inventory of clinicians that we're going to be needing in the future. And a lot of doctors are in like my age, and they're increasingly looking to retire, in part because of the hassles they have with insurance program plans and stuff. And so if we don't fix this kind of thing now, the pipeline is a long pipe. It's a several-year pipeline to build the inventory of clinicians. And if we don't change things fast, both on residencies and what you described on the medical school side, there's going to be a much worse shortage than there already is. And it's really bad in in Arizona, rural areas. And I'm sure it's the same in Michigan. It's real. Some specialties that you just can't get an appointment. You got to drive to Tucson or Phoenix. It's probably the same in Michigan, I'm sure.
Yeah, it is actually a state rep that that I know just needed to have some, pretty advanced surgery. She lives in Traverse City, which is, in northwest Michigan. And yet she had to come down to Ann Arbor in order to get the procedure. And that is becoming more and more the norm as more and more rural hospitals shut down and as there are fewer specialists. But as one of the things that I was talking to AG Mays about was now we are also closing the pipeline of foreign doctors from coming to the United States, which, I know if I look at every single one of my doctors, every one of them, none of them were American born, not one in southeastern Michigan. And I think that that's pretty typical of what you'll see. But what are we going to do if we're making it so difficult to have people come here from countries around the world?
Again, it goes along with the first two things we talked about. It's going to make it more and more difficult. And the visas that are required there, I mean, they're getting super unreasonable about the visas for them to come over and study. So I don't know where this is all going to end. I mean, the American people are going to speak in 18 months, and again in 3.5 years, and the future of the Republican public health is in their hands.
Yeah, I think that's exactly right. And I just pray that we don't have another COVID-like situation, which you were kind of on the front lines of when it happened here in Arizona. You certainly were a voice in all of that. I remember your voice and your guidance during that. Can you speak to and sort of explain to our listeners and our watchers why the NIH is important and why the CDC, why we should care about what is happening to these critical public health agencies and how that trickles down to the states. Because I think sometimes people look at it and they're like, oh, it's just a bureaucracy. But why does this matter to everyday Arizonans and Michiganders?
Yeah, it should matter to everybody. I mean, the reason we have had and made so many really dramatic strides in treatment of things like cancer and really all kinds of medical conditions is because we've invested over the last decades in funding to the National Institute of Health, which pays for at the universities really that foundational science research that establishes the evidence base that then private sector entities can use to develop new therapies. So it starts with the foundational research that NIH supplies the funding for, and then private sector, which plays a really important role in developing these new therapies and medical devices, they do the translational research and then they pay for the clinical trials. But if we don't invest in the foundational research, then there isn't the ability for them to do that translational research and then later the clinical trials that result in the new therapies and medical devices that are saving so many lives. Let me just use a quick example with messenger RNA. So the reason messenger RNA was like mRNA studies through NIH were funded for many, many years, building that basic evidence base for messenger RNA technology. And then that led Moderna, Pfizer, BioNTech, and others to use that foundational research to come up with the COVID-19 vaccine in record speed. So now that messenger RNA research that the NIH provided is really super promising for cancer therapy. And it really has the potential to displace chemotherapy, which is a super blunt instrument when you have cancer, with an immunotherapy based on mRNA technology that can and for like melanoma, for right now it's melanoma and pancreatic cancer, and the kind of brain cancer that Senator McCain had. So those kinds of cancers can, in the near future, be cured with a targeted technology based on that mRNA research that the NIH did. So to get to your question, like Secretary Kennedy wants to cut the NIH budget by 40%. Well, what that does is eliminate that foundational research that ends up later going into translational research and the clinical trials that help improve therapies for cancer and a whole host of other things. And when you cut that pipeline, you're eliminating that foundational research. So you're stalling the future of medical advances, but you're also eliminating the workforce that can do that. And so in 3.5 years, if we all realize finally, oh my God, this country made a huge mistake, we've got to start putting some money back in NIH, you will have researchers who left for Europe, left for China, and did their career work somewhere else, and we will not have the research workforce to be able to recover from this. And that's how it becomes not just a blip in the reduction in medical research, but a long-term atrophy of our ability to do this. And by the way, it puts the Europeans in the driver's seat when it comes to the transition, like that next level research that ends up in clinical trials. They're the ones that end up getting the patents and developing the therapies. They won't be developed here because that foundational research didn't happen because of the decisions made by Kennedy and Congress. I mean, they have to go along with it. And so we'll see what happens. There was a ray of hope that I saw there's a committee in the Senate where I think there's 32 members of this committee, and I forgot the name of it. It's Cassidy might be the chair of it. I'm not sure. They actually, in a bipartisan way, recommended from that committee in the Senate to fully fund, not fully, I think they trimmed them by 1%, but they ignored Kennedy's request to cut NIH by 40%. Now, that's just one committee in the Senate. What would happen on the Senate floor, what happens in the House remains to be seen. But it gave me a ray of hope that maybe checks and balances might still exist, but maybe they won't.
Well, let us hope. I love maybe ending on that ray of hope. I think I don't know if we have time, Dana, for any other questions, but Will, I think you did an amazing job of encapsulating this whole conversation and why it's so important. I find it, frankly, when I think about what's happening at the NIH and CDC, that what you just said is why it makes me so angry, because we are on the cusp, especially with mRNA, we are on the cusp of I mean, just what you just said, possibly, curing forms of cancer, including glioblastoma, what Senator McCain had, and to yank the rug out from underneath that is so wrong and so misguided that let's hope Article 1 wakes up and does something about it in the next few months, because we need them to show up. And Dana and I promise you and everyone else that we'll keep fighting for Americans and for our democracy and for our public health system for as long as we can.
Thank goodness for Article 3 and for attorney generals like you that are standing up for the people.
Thanks so much for being on the podcast, Will. Much appreciated. And thank you so much for all your incredible work. Well, that's all we have time for on this week's episode of Pantsuits and Lawsuits.
Thanks for listening, everybody. Please be sure to follow us on all of your social media and stay in the loop about our department's various legal updates. We'd love to have you continue to follow us, and we will get through this together.
Let's hope we do.
Thanks, everybody. We'll see you next time.